You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dow, and today is October 4th, and welcome to another episode of Last Week in Health IT. As with every episode, we'll start off this one saying that the intended audience for this episode is everyone. So let's just get right into it. The first news item is FDA issues an alert for a cyber vulnerability. So yeah, let's start off with an alert issued on October 2nd, 2019, and the FDA has released a warning through safety communications to healthcare organizations, IT personnel, manufacturers, and patients about a major cyber vulnerability that affects numerous operating systems. The vulnerability has been named Urgent/11, and basically, the connected devices that run a certain operating system has a vulnerability that would allow someone to remotely take control of the device and change any function or cause some sort of failure to the device. And you can imagine, if these devices are medical infusion pumps or dialysis machines that fail during use, the results could be catastrophic. The listed operating systems are VxWorks by Wind River, OSE by ENEA, Integrity by Green Hills, ThreadX by Microsoft, Itron by Tron, and ZebOS by IP Infusion. So the vulnerability is rooted in a third-party software called IPNet, which allows device-to-device network communication. And if you're looking to see if this is going to be affecting you guys, if you do see that it affects where you are working, contact your management right away or contact your manufacturers right away. All right, so the next news item is Allscripts and Northwell Health are working together to create a new EHR. So Allscripts is one of the major EHR vendors, and Northwell Health is an integrated healthcare network in New York. The two are teaming up to develop an innovative EHR that will be cloud-focused and powered by artificial intelligence. In addition, the EHR will be heavily voice-enabled, and they'll be working closely with clinicians on creation of this product. Allscripts has also stated that they'll be focusing on the patient experience in addition to getting input from providers throughout the project. So this is quite a big deal because Allscripts will be splitting time between the new development and also supporting their current Sunrise platform. And I'm interested to see how they do this, and I'll be keeping an eye out on how their development goes because it sounds like a really interesting new endeavor. And the third news item, which is probably going to be the last news item, is Meditech works with Google to host EHRs. So speaking of EHR vendors, Meditech, they have announced something pretty interesting. They're going to be partnering with Google to offer their Expanse platform that will be hosted on Google Cloud. What's really interesting is that this is on a public cloud, but the announcement also says that it will boost security, interoperability, and scalability of EHR customers. So at first I thought this sounded counterintuitive because they're saying the cloud platform is a public cloud. So looked into this a little bit more. To recap, a public cloud will be a third-party hosted cloud system that is accessible on the public internet as opposed to a private cloud that's hosted by the institution or health system. In a sense, Google's public cloud is probably known for being highly secure, so that could be a good thing that they are relying on Google's expertise for handling security with a cloud-hosted EHR. Considering, the alternative, it will be much more difficult to host the EHR in a private cloud due to additional resources that the institution will need to provide to ensure that there's appropriate cybersecurity. Now, on an unrelated announcement, Meditech also said that they're working on supporting health records on the iPhone, and customers will also have FHIR-enabled access for data from all participating institutions. So before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at PharmacyInformatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy ITME. And remember, technology is the tool, patient care is the goal.